It's time now for a very intimate discussion about feminine wellness. If you have children in the room and you'd rather they not hear this, now would be a good time to get them out of the room. For many women, childbirth and just the natural aging process can change their private area, causing dryness, tightness, or leakage. Here to tell us about a procedure to help is Dr. Lori Givens with the Leone Medical Group. Dr. Givens, good morning. Thank you for being here today.
Good morning. Thank you for having me.
Did I describe it right? Can be an embarrassing topic for some if they don't want kids in the room. Now's the time to get them out. But important to talk about. Many women experience changes down there in their vagina because of childbirth or age or surgeries such as hysterectomies. What is happening to our bodies? What's happening to that area?
Well, basically, as we grow and change, and I hate to say it, age, our vagina takes turns, okay? When you have a vaginal delivery, you have tissue that basically gets interrupted from all the pushing and the pressure that you exert. If you have chronic illness like asthma or anything that gives you a cough, you can, put extra pressure on that vaginal tissue and tear it apart, okay? And that happens in youth. And then as we age, lack of estrogen from just menopause, that normal process that we go through, and also from disease processes like breast cancer. If you have your ovaries removed as a result of having breast cancer, your estrogen goes away, and that estrogen provides strength and moisture to that tissue of the vaginal area.
What are some of the symptoms that women can experience?
Well, basically, you can have anything from vaginal laxity, from all of the tearing apart. You can have vaginal dryness from lack of estrogen. You can have leakage of urine when you sneeze, cough, jump up and clap at your son or daughter's soccer game.
I may or may not know something about that.
Yeah.
I think a lot of women who've delivered babies can experience that.
As a mother of 3 and twins, I can definitely attest to that. But, what I am so excited about is that we actually have something that helps and that works.
Okay, talk about that. Tell us what this procedure is called.
Okay, so the procedure is called ThermiVa, and ThermiVa is basically a radio frequency device, and that sounds fancy, but it's basically just heat, okay? It's a heat energy source, and it's delivered at the tip of this probe. And basically what I do is I use this as kind of like my magic wand to touch the tissue in a way that heats the tissue to promote the cells to regenerate type 1 collagen and to make cells also produce vaginal moisture. So, and as you can see, it's tiny. It's not even the size of my finger. So for women that have issues with vaginal atrophy, where their vagina is tight and sore and they have painful intercourse because the vagina over time has kind of shrunk down, this actually helps to rejuvenate that area. It helps to revive it. It helps to make it youthful again.
Your magic wand.
Exactly.
Magic, ta-da! Who's a good candidate for this procedure?
Well, actually, there are women of all ages, childbearing to postmenopause are good candidates because there are some women who just don't like the way their vagina looks. It can help cosmetically as well. Yes, externally. It can, if you have labia that are large or one side is larger than the other one, it can shrink the tissue so that you have more symmetry. But
your patients come in and talk to you about this stuff?
They do.
Wow. You must be a really good doctor.
Actually,
they must feel very comfortable with you.
I do, and I think that part of it is that, I am a board certified OBGYN, and the vagina is kind of my area of specialty. And so when you come to my office, it's not just a cosmetic procedure. It is me assessing your need. And so I look to see where your deficit is or your defect. If you have a bladder that's hanging down, I look at the midline defect. I spend more time in the midline. Or if I notice that you have really atrophic vaginitis, or meaning that it's very dry on the outside, I can spend more time on the external labia, reviving that tissue to provide more moisture.
Now, is there any downtime associated with this procedure? If you go in and you get that magic wand and do your thing, is there any downtime after that?
No, actually there's not, and that's the wonderful thing about this. I have been frustrated as a physician since residency with these kinds of issues with women. All we got was sloppy cream and messy gel, and the cream is estrogen, and we all know that can be harmful. If you have cardiovascular disease or cancer, you can't use that estrogen. It can be life-threatening if you use that. And so it's exciting to me that I can have a 20-minute procedure in the office, and you go home the same day. You can test it out to see if it works when you get home.
Okay.
There's no pain associated with the procedure, and it literally is about the temperature of a hot tub. It's kind of like hot tub warmth temperature, so there's no pain associated with it at all.
How many treatments does a patient need? Is it one and done, or does it kind of depend?
Actually, it does depend, but the standard in the industry, Dr. Alan Sod was the physician out in California that did the original research with ThermiVa. 3 treatments is what's recommended because the first treatment helps the tissue that's there, that's existing. The second treatment promotes the cells to produce more. And the third treatment kind of cements that so it stays in place. And usually patients would require 1 extra retouch once a year, you know, occasionally, but it depends on kind of what tissue you start with, what you know, kind of what God gave you.
Okay. This is so interesting. You're wonderful.
Oh, thank you.
Yeah,
thank you
great.
so much.
To learn more, call Dr. Givens. The number is 704-235-6610. Again, 704-235-6610, or visit her website. It's leonemedicalgroup.com. Note the spelling there on your screen, leonemedicalgroup.com. I really do thank you for being here to talk about this.
Thank you for having me.
All right, still the